Keisha Reaves will be talking about understanding the journey of women of color and maternal mental health. Keisha Reaves is a Georgia native that has witnessed the stigma of mental health and has made it her mission to normalize therapy. She has been in the mental health field for more than 16 years. She obtained her bachelor's degree in psychology and human services from Clayton State University and then completed her master's degree in counseling and psychology at the University of West Alabama. Black maternal health and reproductive education is a strong passion of hers, and her mission is to provide access to resources and mental health services to women of color. Keisha specializes in helping everyday women who seek to improve their ability to cope with their daily challenges through holistic practices and talk therapy. In addition to helping women, Keisha is also certified in perinatal mental health, serving women who are trying to conceive, have fertility issues, have experienced infant loss, transitioning into motherhood, as well as postpartum depression. She has volunteered with Northside Hospital's bereavement group, and she serves on the Postpartum Support International Georgia Chapter Board. And she is currently one of the facilitators of the Motherwise group at Atlanta Birth Center. Welcome, Keisha Reaves.
Hello everybody, thank you for joining the Black Maternal Mental Health Summit. I'm so excited that this is our second annual summit. And of course, we feel as if it's important to talk about signs, symptoms of perinatal mental health and how it impacts Black mothers. I'm a mother myself. I have 2 children and 2 Black sons actually. So I understand the difficulties in which it is for any Black birthing parent to have to go through, not only emotionally, but just the societal impact of motherhood and how Black motherhood is very unique because of the risk factors and the challenges in which Black birthing parents have to experience. So as I go along through this presentation, please pop anything in the chat, what comes up for you as we're discussing these different topics, any questions that you may have. Maria lovely gave my introduction, so I don't need to rehash that, but I do own a group practice where I specialize in maternal mental health, and I'm also one of the co-coordinators in putting together this Black Maternal Mental Health Summit this year, which is near and dear to my heart. And things that we're going to cover today. So we're going to understand the impact of perinatal mood and anxiety disorders on women of color. We're also going to understand the historical and cultural background of motherhood for Black women, and also become a little bit more familiar with the barriers to adequate treatment for women of color. In addition to that, screening tools and treatment options, and we're going to identify some resources and ways that Black mothers can be able to get help. So tell me in the chat, why is Black maternal mental health important to know about? I think that a huge barrier to treatment is not having culturally competent clinicians and practitioners to be able to serve our Black birthing parents. It's one huge issue, especially in the state of Georgia, of being a Black birthing parent and having anxiety, worrying if you are going to survive your labor and delivery. Feeling as if you aren't able to communicate properly to your provider, feeling scared and doubtful of what the experience may be like. And that will take a lot of joy away from your entire labor and delivery story. So Black maternal mental health is a huge issue and something that everyone should take part in. This is a quote by one of my favorite authors, Toni Morrison. And I felt like it really resonated with me. And tell me in the chat when hearing it what comes up for you. I never felt more free in my life until I had children. They were just the opposite of a burden. But for Black women enslaved to have a child that you were responsible for, that was really yours, that was really freedom. Because they took those children. You didn't have children, you may have produced them, but they weren't yours. They could be sold and were sold. To be a mother was the unbelievable freedom. So going back to some of the stats in which Chantel was speaking about earlier today, 1 out of 3 women experienced postpartum depression in comparison to 1 out of 7 non-Black women who experience postpartum depression. Our C-section rate for Black mothers are higher than for white women, and we're also 3 times more likely to suffer from maternal mortality in comparison to our counterparts. And that's an astounding rate when we think about this. And this is due to inadequate medical care or experiencing implicit biases when being treated by medical staff. And some of the myths, and you drop in the chat, what are some myths that you've heard whenever thinking about Black maternal mortality, or just Black birthing parents and their livelihood, and what has been labeled for us? Some that I have listed is Black women are more fertile. Postpartum depression is a white woman's diagnosis. Fertility treatment is only for the wealthy. Black birthing parents do not feel pain. Most Black women are poor and have no access to adequate health care because of their socioeconomic status. Having these myths are the things that provide implicit biases or stereotypes, or not being able to get adequate care, because having to deal with these myths and what practitioners may be assuming is the journey for Black motherhood. So, perinatal mood and anxiety disorders. When you first hear the word postpartum, what is your initial thought? Often in my work, whenever I work with people who are unaware of exactly what maternal mental health is, they hear postpartum and they immediately think that it is depression, it is a mother who wants to harm her children, or someone who is hearing voices or sitting in a dark room. And just to break that myth alone, postpartum simply means after a birthing parent has given birth. It is that after birth period. But to go a little bit deeper and to give an actual definition, perinatal mood and anxiety disorder is an umbrella term for mental disorders that women encounter during pregnancy up to 1 year after birth. So it's not just after birth, but it's once a birthing parent is pregnant for that full year after they've given birth. And it includes more than just depression. It is an entire range of different disorders that one could be able to consume. So revisiting that statistic, I really want this to sit with you as you kind of like hear about the Black birthing parents' experience. So 1 out of 7 experience a mood and anxiety disorder during pregnancy after birth. But for Black mothers, 1 in 3 experience a mood or anxiety disorder during pregnancy or after birth. And for single Black women, that statistic doubles. So when we talk about the umbrella term and looking at it as a spectrum, you can see from this example how it's several different diagnoses in which a birthing parent could experience. The most common is the antepartum anxiety and depression, postpartum depression, postpartum anxiety, as well as postpartum post-traumatic stress disorder. Postpartum psychosis is the rarest. Only 1 to 2% experience this. And then there's also postpartum OCD and postpartum bipolar disorder. But when we talk about the most common with antepartum anxiety and depression, similarly, that's for Black birthing parents that may be anxious about their pregnancy, if they're going to be able to survive, live. And then postpartum depression and postpartum anxiety are also very common. And something that I also want you to know as we go through this is all of these are highly treatable. When we talk about that statistic, also being able to normalize the fact that it is very common and anyone can get treatment and receive help and feel more so like themselves afterwards. So what causes perinatal mood and anxiety disorders? Various contributing factors, such as a history of mental illness, hormonal or chemical imbalances, and also some risk factors. So risk factors are huge and something that I want to put a little bit more emphasis on because we don't talk about that a lot. A lot of things can be going on environmentally in your life, stressors that can increase your risk from experiencing PMATs is what we call it for short, such as sleep deprivation, if your baby is colic, if you're having any type of financial stress. The pandemic was a huge risk factor. Someone who's recently moved, gender discrimination, job stress, workplace issues. If someone wants to breastfeed and they go back to work and there isn't a place where they can pump, that can cause a lot of stress. History of infertility or previous perinatal losses, history of trauma. And looking at this list, this is just a small list. So this list can be huge and can be for many, many things. But this is just to give you an example. Going a little bit back to antepartum depression and anxiety, and looking at some of the symptoms, feeling very anxious, having low self-esteem, dread, feeling not prepared, loss of interest in activities, and unmotivated to take care of yourself. And this rate may be as high as 15% in some countries. And something's common. And one thing that I do want to highlight as we talk about the umbrella of PMATs is being able to educate so many people on exactly what it is, because some people thinking that it is only postpartum depression, if they're experiencing anxiety during their pregnancy or even after, they may think that something is wrong with them because they're not experiencing depression symptoms. But this falls into it as well. So when we think about for Black birthing parents experiencing antepartum depression or anxiety, let's look at some reasons why they would. When we think about the mortality rate for mothers, specifically in the state of Georgia, even looking at this statistic, a Black mother with a college education is at 60% greater risk for a maternal death than a white or Hispanic woman with less than a high school education. The causes of death can vary from hemorrhaging. Looking at the ratios, all of these stats can be very triggering and can cause anyone to be anxious regardless of their socioeconomic status, their educational background, even if they've been healthy, have taken great care of themselves. And it's something that could definitely sit with them. So to go back a little bit more as to why there is a lack of trust in the medical system, specifically for Black birthing parents. When we look at Dr. James Marion Sims, which is the father of modern gynecology, historically, we know of him as being someone who contributed a lot to the gynecology field, but however, used to practice on his own slaves. And this is before getting consent to treatment, doing treatment on his slaves without using any type of numbing, making sure that the person whom he was practicing on was comfortable. None of that was taken into consideration. And this is just a small example of Tuskegee syphilis experiment, what happened with Henrietta Lacks. So this is a long-going period of there being this myth that Blacks feel no pain, as well as practices that aren't ethical. In addition to the lack of trust in the medical system, if any of you have not listened to the 1619 Project by New York Times writer Nicole Hannah-Jones, I highly recommend it. But we also had a contribution of Rebecca Lee Crumpler, who was the first African-American medical doctor in the United States, who created a book of medical discourses in 2 parts. And she was able to help Black people, precisely Black mothers and Black nurses, in teaching them how to medically take care of themselves through homeopathic methods, as well as any type of home remedies so that they could be able to survive. Next, we had another contributor, Dr. Montague Cobb, who was a medical doctor and professor. And he was able to fight against being able to have segregation in our hospital systems. So when hospitals were segregated, Black hospitals got hand-me-down facilities, supplies, and resources. And they were not able to have proper care medically because we didn't have everything that we needed in order for that to be done. Other contributing factors for Black birthing parents to experience antepartum depression or anxiety is also what's going on with racism, discrimination, police violence. Even speaking personally for myself, I had my son, my last one, in April 2020. As soon as I gave birth, George Floyd died, was murdered, and Breonna Taylor was murdered in Aubrey, here in Georgia. And being able to take all of that in consideration, it will cause anyone to have increased anxiety and worry. Implicit bias, this is something that we include in our perinatal mental health 101 training, where we make sure that any practitioner is able to check their implicit bias, whether it's conscious or unconscious, so that they are not treating anyone differently based off of any type of stereotype or attitude that they may have and carry, so that adequate care is given. These are some examples of postpartum depression. Being able to look at the difference between baby blues and depression. Baby blues is 2 weeks after giving birth, 80% of birthing parents experience it. And postpartum depression is more intense symptoms that last past those 2 weeks. So when thinking of risk factors, what risk factors could possibly contribute to a mother having postpartum depression? We talked a little bit about postpartum anxiety and about postpartum depression, as well as antepartum anxiety. These are a couple of symptoms as well, and being able to take those in consideration. Any type of mom being able to worry about her child, having racing thoughts, constant near worry, can't be eased. Those are some of the symptoms. Also, there hasn't been a lot of research done as far as how to care for Black mothers who experience any type of attachment or anxious attachment with their own children because of that anxiety. Postpartum post-traumatic stress is often occurring whenever someone experiences anything traumatic during their birth or labor, or their baby is going into the NICU. Cultural sensitivity checklist is something that anyone can be able to check in with themselves to make sure that they're culturally competent in working with any type of patient or client. And examples of what to say, like we talked earlier, normalizing, this is common, this is something that is treatable, you are not alone, you can get help. And strong Black woman syndrome, huge. There's no one else that can get it done, it needs to get done, I have to take care of it. As well as, I don't have time to be sad, things need to get done. This kind of goes back to when Chantel was talking about that statistic of Black birthing parents being least likely to seek out treatment, being able to help Black mothers work through this cultural ideal. And lastly, I always like to talk about statistics do not define a client's fate. Although we see these stats, knowing that no one has to have this be able to define what your experience may be. So when we talk a little bit about treatment options, being able to go to therapy, finding support groups, holistic approaches, social supports, family, friends, church, group therapy, all of those things are things that can be helpful. Getting a doula, being able to have a support person to help you get through it, not feeling as if this has to help you or has to happen to you. And then also taking in consideration that you're not only treating the birthing parent, but also the entire family. So to wrap it up, I want to talk about how we help the Black birthing parent to stop suffering, support comprehensive healthcare coverage, improve access to culturally competent, well-trained mental health providers, support the integration of mental health screenings, fund large-scale, culturally appropriate public education campaigns, additional research, develop policies and education campaigns, healthcare providers and patients and communities, support cultural shift efforts, amplify and support women of color-led organizations, and support policies that improve work-family balance. These are a couple of resources that I like to highlight. The Grady Trauma Project will be talking today. The Earth app, Kimberly is going to be talking next. And lastly, I know it was a lot of information and it's so much to try to cover in 30 minutes, but any questions? Anybody have anything to pop into the chat really quick for us to talk about? Okay, let's see here. Yes, someone said that they use the Edinburgh with their clients after birth. The Edinburgh scale or the PHQ-9 scale are the ones that's highly recommended. I am located in Atlanta, Georgia, and right now I mainly only do my group practice. We just do telehealth services since the pandemic started. The resources slide, yes, I'll leave that up. A recording with all the slides will be posted. Good. Any other questions, anybody? I'm trying to see. I'm blind. Yes, some of this information will be available when the summit is over. And also to keep in mind, so I'm on the board for PSI Georgia, and I am the lead for our training committee. So I help facilitate all of our trainers throughout the state of Georgia to do informational training such as this. And we're also working on being able to provide trainings on specifically Black birthing parents. That'll be live on our website, as well as a training for overall parents on signs and symptoms of PMADs. So that is coming soon. And let's see, does postpartum anxiety contribute to postpartum rage later? It can, if it goes untreated without seeing a therapist. The anxiety could become so intense where someone could experience depressive symptoms and also have some rage. And lastly, if someone doesn't meet criteria on scale but feel they're having significant symptoms, what should they do next? Schedule an appointment with your therapist. On our PSI Georgia website, we have a directory where we have a list of all certified maternal mental health therapists in the state of Georgia. It also indicates if they accept insurance or private pay. So you can be able to book a session with anyone that's listed. Plus PSI also has a helpline where you can call, speak to someone that is certified in maternal mental health, and you leave a message, they'll return your call within 24 hours. We also have 11 state coordinators that you can also contact, and they can connect you with resources that's within your area, whether that's in your county, community, or nearby. Get you connected with a group or any provider that can support you in whatever the symptoms that you're experiencing. Thank you, everybody. I know I probably didn't get to every question, but I know that we have so much to cover today. So all of my information is on our PSI website, and ask me any questions later on. Enjoy the rest of the summit.